Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room, where I talk about issues that concern your human dignity and well-being. In this video, I want to talk about how you can identify fake, controversial, or questionable healthcare products or services so that you can make the right decisions that concern your health and longevity, and so you can also have value for your money. All right. Now, we don't always assume that anybody who has been shortchanged whilst patronizing a questionable product is doing so intentionally to cause himself or herself harm. We think people do these things out of ignorance. Okay. So I don't judge such people. Now, sometimes it takes a trained mind to tell the difference between what is fake and what is original. So that's why I'm doing this video, to help you identify these questionable products so you can make the right decision when the need arises. Okay? When we talk about medical quackery, we're talking about a situation whereby a person is promoting a product, or a product is being promoted, a service is being promoted, and this so-called healthcare product or service has not been found by scientific proof that it works or is safe to use. So there's no scientific proof to suggest that this product works and this product is safe to use. Okay, but they are being promoted as if they can solve health problems. Now, this can be done intentionally, and when it's done intentionally, what we say is that the person is perpetrating fraud, health fraud. All right, but we can also have people who are just ignorantly promoting products that don't work. There are people that like to say that they have acquired some skills or knowledge from their predecessors. Through apprenticeship, they have acquired some knowledge and skill to provide some traditional treatments or herbal treatments and so on. These people actually think that they can solve health problems. Only that the outcomes that we see suggest that they're actually causing more harm than good. So whether we are dealing with a situation of being intentional and perpetrating fraud, or ignorantly promoting products that don't work, we are still dealing with a situation of medical quackery. And because the end result is that somebody is being told that he or she is receiving treatment, when in actual fact, these are not proper treatments. Okay. So how do we determine if a product or a service is questionable? Number one, if a product or service claims that it can treat a lot of medical conditions. So this one product can treat hypertension, can treat diabetes, typhoid infection, hepatitis B, stomach ulcer, menstrual problems, and tooth decay. And the list goes on. If you hear of a product being advertised as treating so many diseases, please, that product is questionable, because in proper practice, all right, different diseases go with different treatments. We have specific treatments for specific diseases. Okay. Now, number two, the second way you can tell if a product is questionable is when the product or the service is directed towards treating symptoms of diseases, and they are not addressing underlying causes of diseases. All right. So you can have a product that is being marketed as it improves urine flow. What about the cause of the urinary problem? Assuming that these urinary symptoms are coming from a prostate disease, an enlarged prostate, or even a prostate cancer, that patient should see a urologist or a prostate doctor who should manage this prostate disease. Sometimes remove the prostate, and then the urine can come back. The urine flow can be improved, right? And the prostate is the cancer is dealt with, the person does not die. So if the concern is this is a product that improves urine flow, what about the underlying cause of the urinary symptoms? Okay, so if you come to the health facility, you have a fever, you're feeling hot in your body, and I give you only paracetamol to reduce the fever, I don't address the infection or maybe some malaria causing the fever, it is going to come back. The fever will come back. So we always ask in proper practice, okay, why is somebody having these symptoms? Because symptoms are clues to diagnosing diseases, underlying problems. But products being advertised out there to treat constipation, to treat menstrual problems, to treat waist problems, okay, to improve urinary symptoms or urine flow without addressing underlying causes. They are questionable products or services, right? Number three, what is the third way that you can identify a questionable or a fake medical service or product? Number three, if this product or service or practice is advertised as if um, it can cure medically incurable diseases. So there are products that have been advertised as they can cure medically incurable diseases. These products are questionable because when we say a condition is not medically curable, that claim is made by science and not by the person saying that, making that statement. So if you say you have a cure, it means that you have a product outside science, a product that has not been tested by science, okay? That it can actually treat this condition. Because as far as we are concerned, science has considered all products available, all services available, and come to this conclusion that it has not yet found a cure for this particular condition. Okay, so any product that claims a cure for an incurable condition is actually operating outside science, and that product is questionable. Okay, so number four, the fourth way to identify a questionable product or service is that that product or service is being marketed or that practice is being promoted as the best among the rest. What it means is that when somebody has a medical condition, the person should bypass all facilities and look for this one practitioner. So if you have an emergency situation, if you have a heart attack, if you're a woman, you are bleeding in pregnancy, they carry you in an ambulance. All ambulances must go and look for this particular healthcare practice or practitioner or service, okay? That is not how it works, all right? In healthcare, we try to decentralize healthcare as much as possible because we want to bring healthcare to your doorstep. So that if you have an emergency situation, you can receive timely and prompt care and you don't lose your life. All right. So if somebody is promoting his practice, products or services and saying that I am this powerful, wonderful healer or practitioner or practice, that everybody should bypass all facilities and come to mine, okay, that person is thinking more like a businessman or a business person and is not thinking about saving human lives. Okay, and we do a lot of coordination of care in proper practice, and we do a lot of teamwork in proper practice. So you can have one patient being managed by 4 different specialties. One patient being managed by a cardiologist because he has a heart problem, and that woman is pregnant at the same time and has some complications. So an obstetrician or a gynecologist is managing that woman. Then probably she also has eye disease that is being managed by an eye doctor, okay, or a kidney failure that is being managed by a nephrologist. One patient is being managed by 4 different doctors or specialties. So why do we then think that there is this powerful healer, powerful practitioner somewhere that everybody should go and look for this person? All ambulances should be heading towards this particular service, okay? That sounds more like a scam. All right. Number 5, how to identify questionable healthcare products or services. Number 5, when a healthcare product or practice or service is relying on testimonies or word of mouth to build confidence in people for the product or the service, that is a questionable product or service, because when it comes to healthcare, proper healthcare, our evidence or our testimony is the evidence that is established through research. Okay, through research. So we know that a treatment will work not because somebody has testified that it works, but because it has been experimented. That treatment has been researched, okay, and has been tested, and we have found that it works. That is the confidence I have to prescribe that treatment to you. All right. And I don't really need any testimonies. I don't need you to go and testify about the fact that you came to the hospital, you went on admission, and then you got treated, you were well, and you were discharged. You don't need to testify because we expect that when you come to the health facility, you should go home healthy. Okay. But products or services that rely on people to testify and provide juicy, enticing testimonies to convince others about the product or service is questionable. And when it comes to testimonies, medical testimonies, science is very careful because we consider testimonies as being subjective reports. Okay, so people can introduce some bias into the narration so that the final proof or evidence we are trying to establish, there's some bias introduced into it. So we try to eliminate testimonies, okay, when we are trying to establish proper evidence. We rather try to go for some measurable outcomes. Okay, when I give you BP medication to treat high blood pressure, I will measure your blood pressure to make sure that it's coming down. When I give you medication for diabetes, I'll measure your blood sugar to make sure it's coming down. Okay, so all the time we have to have some measurable outcomes aside people reporting that I feel this or I feel that or I feel better. Okay, number 6, the sixth way to identify questionable healthcare products and services is when a practice is marketing itself or is promoting itself in a manner that suggests that you can do without orthodox practice. So this practice can tell you that stop taking your orthodox treatments and use these products only. Anytime you hear such statement being made, stop taking your orthodox treatments. Okay, stop taking your hypertension medications, stop taking your diabetes medication. That is a questionable claim because or suggestion because it's what is being said is that what that implies actually is that stop taking your treatments or your medications that have been tested by research that they are safe to use and they're effective for treatments that have not been scientifically proven to be effective and to be safe to use. Number 7, how do you identify medical quackery, questionable products or services? Number 7, when a product or a service is being marketed, all right, with the supernatural being used, okay, in connection with that product or service. So people say that I am not the healer, God is the healer. But the person is not only praying for you to get some supernatural healing, the person is promoting some product, selling some product to you. Okay, then we are not sure whether it is a product that is working or God is working through that product. And that is why you receive some health solution. That is quite deceptive. Okay, natural products should prove themselves as worthy of as patronizing them without calling in a supernatural, okay, to support their claim that they work. All right. When the product has proven that it works through some research, the supernatural just becomes an addition, an advantage, okay, in any case. But we must be able to separate the natural product from the supernatural and give some credit to this product as it can work even without the supernatural. Okay. Otherwise, what it means is that we are playing on the emotions, on the vulnerabilities of religious people to patronize such a product, okay, by bringing in the supernatural, okay. Then number 8, the 8th way to tell if a product is questionable or not is that there are some people promote diets or food supplements as actual treatments for diseases. So we call them dietary cures, okay? Diet has a place in medical practice and is used as an adjunct or an addition to sometimes medical treatments, okay? But where you are asked to stop doing or taking all kinds of medical orthodox treatments and just practice some dietary regimen to cure a certain disease, be careful about such claims, all right? And when it comes to food supplements also, as the name implies, they are supplementing food. So they are being added to food to make it complete, with the thinking that for whatever reason, you are not receiving adequate amounts in what you eat, okay? Maybe you're not absorbing nutrients enough because of some medical condition, or you are very ill or facing some medical condition that is not making you eat enough. So we have to supplement your diet with food supplements. That makes sense. But if we advertise food supplements as treatment for diseases, it's like saying that food is a treatment for a disease, okay? Because these food supplements are just like food, that's nutrients that have been captured in the form of capsules or in form of tablets and so on and so forth, okay? So these are the 8 ways to identify if a product is fake or a service is questionable or is controversial, okay? Thank you very much for watching this video and subscribe to my channel. And also visit my website, www.dryebi.org. Thank you.